It is 7:25 and we are continuing our coronavirus outbreak coverage this morning by speaking to those who know the most about this disease. We are joined this morning by Dr. Andrew Jameson, Chief of Infectious Diseases and Medical Director of Infection Control at Mercy Health. Doctor, thanks for joining us once again this hour. We appreciate it.
Good morning.
Well, let's talk about, I know last hour we had talked about if it's more like a flu or it's more like a common cold. And for our viewers who just joined us now this hour, can you explain the difference?
Yeah, so this does behave a little bit more like the flu, like influenza, than it does a common cold in terms of the severity of symptoms. The things we really look for are shortness of breath, cough, and the fever. And the biggest distinguishing factor that your listeners can look for is the progression of symptoms. Most common colds get worse in the first day or two and then slowly get better, where this is something that gets worse steadily. So we use that as a big breaking point for us when we're talking about evaluating patients and whether we want to test them, is as the symptoms get worse and get more prolonged over time, that increases the likelihood that we might be dealing with something like corona instead of just a common cold.
So the president has talked about this maybe sticking around until July, August. What have you seen here in West Michigan and in the state of Michigan as far as has it peaked? When do you expect it to peak? That kind of thing.
I don't think any of us in Michigan think that we've peaked yet, unfortunately. As we ramp up testing capacity, we'll get a lot more idea of what we have in our community. The biggest thing we're looking at is planning for the worst and hoping for the best. I think that the community's taking steps right now to promote social distancing and to decrease the transmission between people right now is immensely essential. It is something that we can do as a community that makes a huge impact on this. There's something called amplifiers that we're trying to avoid. So we're trying to avoid the situation where one person has the potential to infect 5 to 6 to 20 to 30 people in one place, and that if we do have transmission between people, it is really much smaller, like 1-to-1, and we can really interrupt that transmission quickly. So what we're doing in Michigan is really focusing on the social distancing, everyone taking this as a community approach where we work together to try to stop this, and then we can control it, and then planning for the worst in the healthcare setting, so and then hoping that we don't have to utilize it.
I know that I'm sure there's families out there who are saying, well, I'm being told to stay at home. I'm healthy. My entire family's healthy. Why is that necessary?
My personal view and what I do for my family is really just a social, ethical standpoint. You may be healthy and you may not be someone that is at high risk of getting a severe infection from corona, but the issue is whether you have it and then you're interacting with someone who is at high risk, or it's just the impact of individuals staying away from each other to help prevent the spread to the most vulnerable in the population. Because it's not the younger, active, healthier people that will be most impacted. It'll be the people that are on the older side, people with medical comorbidities, and then the stress that puts on the healthcare setting, and then potentially transmitting to healthcare workers. It is a huge domino effect that everyone can have a huge impact on early on, and they can have an impact as an individual.
Certainly, we've been told to wash our hands. Is there other things that we should be thinking about as far as cleaning, like washing our clothes, that kind of thing?
Yeah, we feel like that the routine washing of clothes and putting through the washing machine at the highest temperature that is safe for that fabric, drying it completely, those all have huge impacts on this. And it is safe to wash your clothes with something that could be in contact with coronavirus, and combining that with routine laundry. The CDC has great resources for that. And there's actual big links of saying, like, what do households do? How do you do things cleaning? When you are using a cleaning supply at home, we want something that is containing at least 70% alcohol or a bleach solution. The nice thing about this virus is that it is very, very sensitive to cleaning, and it is not very hard to kill.
All right. Dr. Jameson, thank you so much for your time this morning. We certainly appreciate it.
Absolutely. Take care.
Well, make sure to stay with Fox 17 on air, online, as well as our mobile news app for the latest on the COVID-19 pandemic. We also have a special coronavirus section on our website with everything that you need to know.